Hi. So today on the blog I'm talking about a new study that we just published coming from my PhD thesis. And so the study was published in PLOS One, and it looked at the association between breaks in sedentary time and health in children with a family history of obesity. Now the reason for this study was that in adults we know that the breaks in sedentary time seem to be a good thing. So even if you and I spend the same amount of time sitting every day, if I have a lot more frequent breaks in my sedentary time, so I'm getting up off my butt a lot more often, even though we have the same total amount of sitting time, I'm likely to be healthier than you are. And so we know that in adults. So Jen Healy and her colleagues from Australia have shown that a couple times. But there have been a few studies in kids done by Rachel Colley, Val Carson, and a few others, and they've all failed to notice this sort of relationship between breaks in sedentary time and health in kids. And so we were wondering if maybe that relationship just doesn't exist in kids. So what we did with this study was we looked at kids with a family history of obesity. So they came from the quality cohort, which is a cohort of kids that have at least one parent with obesity. And what this means is that these kids are themselves at increased risk of obesity and increased metabolic risk. And so we thought, if we're going to see a relationship between breaks in sedentary time and health, we might have a better chance of seeing it in these kids because they might have a bit more elevated risk at baseline compared to the general population. And generally speaking, kids are really healthy, so sometimes it's hard to see relationships between behavior and health in kids because they're just so healthy, even if they have unhealthy behaviors. And so what we did was we used accelerometry to measure the amount of physical activity, sedentary time, and breaks in sedentary time in this group of kids over a week. And then we measured a whole bunch of health risk factors. We measured blood pressure, insulin levels, glucose levels, cholesterol levels, triglyceride levels, and then we combined all those risk factors into one big global risk score. So someone with a higher risk score is someone who is at greater risk of developing chronic disease down the road compared to someone who has a lower global risk score. And what we found was that in this group of kids, both boys and girls, the more frequently they took breaks in their sedentary time, the lower their global health risk. And that was in both boys and girls. And that was independent of how much time they spent being physically active and being sedentary. So just like we've seen in adults before, if we have two people that have the same amount of physical activity, the same amount of sedentary time, the one who has more breaks is going to be healthier than the one who has less breaks. Now we also found in this study something that's sort of just confirming other studies by our group and others. We found that screen time was strongly associated with increased risk in these kids. And what was interesting was that for boys, it seemed to be video games that were most closely associated with risk, whereas for girls it was TV viewing. And that's, again, not new. So it's interesting now that several studies have shown this, that video games really seem to matter a bit for boys and TV viewing for girls. But across the board, screen time is very consistently associated with increased health risk for both boys and girls. So just a few final caveats in this study. This study was just cross-sectional, so we can't say that kids who increase the number of breaks in their sedentary time are therefore going to become healthier. We don't know that. In this study, we just saw kids who had more breaks also happen to be healthier, so it could be that maybe being healthy makes you break up your sedentary time more frequently. We're not sure. So we can't say that one caused the other. But on the other hand, we did have a large sample. We had more than 500 kids, and as I said, they all came from families with a history of obesity. So the findings are clinically relevant in that respect, because these are the sorts of kids where you really want to know what is associated with health outcomes, since they have a greater risk of developing health problems down the road. So the study is available open access in PLOS One, so look for it there, and it's also available on the blog at Obesity Panacea. So thanks. Bye.